So I want to start off talking about how counselors are different from teachers, because this can be a struggle for school counselors who are alone on campus or outnumbered by the teachers on campus. And it can um, be even more difficult for people who have already practiced as a teacher. And that was me coming into this profession. I was a teacher, then a school counselor, then a clinical counselor. So um, kind of having an idea of how they differ is helpful to try to keep your feet planted in the counseling profession. You'll read articles about this, but I thought I'd give you kind of a little bit of a quick insight to it. So keep in mind that the school is really kind of one big team. We're all working towards the same goal, and everybody brings different skill sets. This is me long ago when I first started school counseling. This is my principal, who I started with, who had assigned me all the duties on the planet except for anything having to do with counseling. This was our assistant principal, and then these are various um, teachers, security guards, and such that were on campus. Everybody brought their own role. This was our school librarian, um, and their own unique skill set. So keeping in mind that we are not teachers. We let the teachers be the expert of teaching skills. Even if we've been a teacher, do not step into telling teachers what to do, how to run their classroom and manage their classroom, anything like that, how to teach academics. That is not what your training consists of. We appreciate all the teaching skills, classroom management, lesson plans, academics, everything that comes with being a teacher in front of the classroom, because it is a very difficult job. Been there, done that. And it is no easy task. So there's a great appreciation for the teachers and the skill set they bring, but you need to consider what you are working with students on is social and emotional needs. And it's not the same thing as teaching math or art or PE or Spanish. It is working on changing personalities. And if we just could teach the facts to students that do your homework and study, everyone would do well. Everyone would do their homework and bring it to school and turn it in. But as you know, that is not the case. Students know what to do. We've told them what to do. But it's our job to understand where they're stuck, understand their psychology, what they're getting out of it. Not Pavlov's dog and behavior modification, but to truly understand their personality and help them move past where they're stuck, so that they will do what needs to be done, such as homework. And if teaching the facts work, we'd all eat healthy, we'd be fit and working out. I would be. I know that that's what I'm supposed to be doing. Do I? No. Have I had a gym membership? Yes. Did I go for a week and then never go again? Yes. So I know the facts. You know the facts. Are we eating right, working out? All of us? Some do, some don't. Um, how about just say no? If that worked, students wouldn't have an issue saying no to drugs, saying no to peer pressure, the psychological addiction, the physical addiction, because we said that just say no. That's how we teach math. That's how we teach English. We tell it to them, they memorize the facts, they regurgitate them. But just saying no does not create a change. Um, there is the teaching component of giving them basic information about drugs and what they do so they're informed and hopefully influence their decisions. But there's the counseling aspect of saying no to drugs as well. Teaching about drug addiction is lessons, facts. You've possibly heard of this is your brain on drugs with the egg in a frying pan, that they're bad, they can kill you, they mess you up, and then the just say no, which, by the way, funding was cut because it was found that Just Say No program actually increased drug usage. So that is no longer a funded program. So that's teaching, giving you the facts. Counseling delves into an understanding of what makes it difficult to say no, of a student's need to be accepted, of peer pressure, of running away from things in life that are difficult and hiding in drugs and the high that drugs bring. It's the struggle, it's the slowing down, the listening, the compassion that we bring, without a lecture, without berating them, without the disappointment. That there is a subtle difference between teaching and counseling, and we have to be cautious not to fall into this teaching mode. A lot of school counselors become mini teachers, and they forget the skill set of asking questions, to probe deeper, to understand, to listen, that empathy that we have. So we use our counseling skill set. This is what sets us apart from the teaching side. Some of it is teaching. That is just lightly touched upon. We process, we ask questions, we slow down. We're not in a hurry to do anything. We listen, we join with them. We create what Tabor calls a holding environment. We do reflection, immediacy, summarizing, all of the skills that you're going to be learning in your techniques courses in Residency 1 and Residency 2. We cling to those. So to further explain this, you should have watched that first clip posted here, Made in Manhattan, about this young boy who needs to give a speech. If you haven't, you should watch that now. And if you have, just keep going. Otherwise, pause, watch it. It's like 3 minutes long, and come back to this. But in the clip, this young man is trying to give a speech on Nixon, and he gets stage fright, and he runs off stage, and his mother follows him. And the mom has particular actions that she takes on that are parental. What the mom did is appropriate. It's also what society's norms are for us to do, and where we fall back as human beings, and you probably fall back at this point too. Think about the mom. She rescued her son. She tried to make him feel better. She offered him a present. She didn't really listen to him. She just wanted him to feel better, to be happy, not to be sad, not to be disappointed. She offered encouragement. All of these things are rescuing, trying to convince the student that how they feel and where they are at right now needs to be changed. They need to get out of that. And that doesn't teach the student to manage internally that anxiety, that frustration, that disappointment. It rescues them and pulls them out of it. What a teacher would do is offer them another chance. Practice with them. You can do it. Just praise, 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 praise the student so that they will get back up there, not feel discouraged, and they will do it again. They will try it again. They will memorize it. Allow them to come in before school and after school and all of these things to get that academic piece done. So they can have a grade, so they can have a sense of accomplishment. And there is some counseling and some emotional and social well-being involved with what the teacher does to build up the self-esteem and that sense of accomplishment. Absolutely. Let the teacher have that role. Let the parent have their role. And then as a counselor with this very same student, the way you approach the student is different. You consider your reaction, you consider your own internal angst and understanding of the student, of the child, of the teenager. Where are they coming from? That empathy is tapped into, that compassion is tapped into, not sympathy. Excuse me. And that's called joining him, to have a sense of being human and understanding that sense of shame, vulnerability, disappointment that comes along with not doing as well as we wanted to. And we don't rescue the child or the teen from that emotional reaction. Our role is to help them be able to be comfortable sitting in it, to manage to go through it and come out on the other side. And we do that with our skills. We consider what he's not saying. We slow down. We reflect feelings. You're disappointed. You're upset. You're angry. We join with that student until they feel heard, till they feel understood. And And that's our role, not to rescue them and make them feel better, but to make them feel understood so that they realize that it is a fair and genuine reaction to that situation to be disappointed. And it is okay to feel that way. And they can manage those internalized feelings and get through to the other end. Because if they don't, you become an adult who, when you have those emotional reactions, you don't know how to manage them. It creates anxiety, it creates depression, it creates all sorts of things that then require a much deeper intervention. So your role as a school counselor is to help students learn to manage that in a healthy way. And you even do these types of skills when you're doing guidance lessons. Your teaching affect is different than a teacher's affect. Um, and then you consider your own personal theory of how you believe people change. How will this young boy get better? How did he become maladaptive? Internally and psychologically. What is the counselor's role? What is the counselor's way of being? What are techniques that the theory says would be helpful? So that's where you throw in the theory. So the basic skills of counseling are all the same. How you conceptualize and help somebody work through that is where theory comes in. You need to know what you personally believe and where your comfort zone is. If you believe it's maladaptive beliefs, you're an Ellis, REBT. If you believe it's lack of awareness, Fritz Perls, which is Gestalt. If you believe there's lacking of insight, and that the past and who we have been and how we have developed, you're looking at Jung or analytical psychology, and that's my frame of reference. That's my theory. If you think it's society plays a role and um, our goals, our way of fitting in, then you're an Adlerian. If you think it's choices, which is a very shallow, solution focused, what have you done before? Do that here, apply that here. Then that's choice theory. If you believe it's a sense of self-worth, Rogers, and play therapy is a whole different animal unto itself. And that's how you would work with the child um, through through the issues. So you have to know what theory fits you and why you're choosing what you're choosing. And then finally, we also add in all of the developmental theories. You should know Erikson and Piaget and Kohlberg and Bloom's taxonomy inside and out. One of my favorites is Vygotsky. Not only do you need that for the licensure or certification exams, you really need to understand how social development, which is Erikson's theory, impacts students' sense of self, how they learn about themselves through other people, through the eyes of others, as opposed to the eyes inside of themselves. And Piaget's cognitive development. And Greenspan believes that it's both cognitive and social development that are important. I love Greenspan's work, not the economist, Greenspan, the developmental theorist, who learned and developed his theory studying autistic children. So, and Kohlberg's moral development, Bloom's taxonomy about how students learn. Vygotsky is how you build upon your learning. Scaffolding. You take what you know and then you add one more piece and one more piece. And so you should know these theories as well, because knowing Erikson and Piaget will help you understand the young man and where he is developmentally, which is equally important because you're not working with adults. You're working with kids who are still developing their sense of self, sense of worth, sense of identity. So you need to work hard to remain within the counseling mindset and hold fast to what you are as a counselor and not a teacher. That includes the questions you ask and the way you are with a student. So hopefully this sets you off on the right foot to consider identity as a school counselor. Let me know if you have any questions at all or comments.